that in women, UTI is very common, and it's got an incidence, or this called like what we call a twin peak incidence. First incidence peak is in the early sort of adolescent to sort of early adulthood, when women start becoming sexually active. And then the second incidence peak comes towards perimenopausal and menopausal era. And they have slightly different risk factors for them. The problem is that UTIs have been there for centuries, if not sort of civilizations, but still it's very poorly understood as to why it happens. And majority of women who get cystitis or bladder infections are healthy uh, patients or healthy population. They don't have any risk factors. They what we call simple UTIs. They don't have any secondary urological issues. And then coming to Dr. Garg's point, is very important that there's certainly an epidemic or sort of an increase of incidence of prostatitis or pelvic pain in men, especially since working from home has become more sort of prolific.
Dr. Kucheria, if I may interrupt for our for the people who've joined us, what is prostatitis? Can you just explain that in simple terms?
In the sort of urinary system, women have kidneys, a tube called ureter between kidney and then bladder, and a tube which brings the urine out called urethra. And women have sex. The sexual organs are separate from the urinary system. In men, the urinary system is also, especially the lower part of the urinary system, the sexual system is attached into it, or sort of is combined into it. And where the two meet is a small gland called prostate, which it's sort of a functional element in sexual function or reproduction. But also, as urine passes through it, prostate gets bigger in size with age. It causes prostatitis or prostate problems like bladder outflow obstruction. So it's important to understand prostate is a small organ in men, just after the bladder, if you sort of follow the sort of flow of anatomy. So prostatitis has increased since we've been working from home. And one of the things which has been shown is, when you work from home, you tend to sit on uncomfortable chairs because your office or home chair may not be as cushioned or as good as an office chair. And you tend to work on a computer. So you're sort of sitting for a prolonged time, putting a lot of pressure on that part of your pelvis. So that's what we can discuss that in detail. I'm sure Dr. Garg will have more to explain about that.
Absolutely.
But yes, there has been an incidence in working sort of age groups since work from home has become more common.
Okay, great. So thank you for that, and I'm sure that our women viewers who joined in perhaps will also take note of this for their male partners or male family members. Let's deal with a couple of myths. I'm going to sort of break up the science a little bit and get a little more interesting also. So Dr. Nidhi, I'll start with you. One of the myths is that you can get, many times, I get patients saying, I used a public toilet and now after that, I think I have a UTI. Any thoughts about that, using public toilets or not so clean toilets? For women especially, men do have the luxury of standing. But your thoughts on this, making women prone to UTI or giving them UTI?
So actually, there is no evidence to say that, UTI can be caught from a public toilet. And basically, for the UTI to happen, the organism or the bug has to get in proximity to the urethra, basically from where the infection starts. And that is really not possible unless there is some cut or some breach on the skin. So for all practical purposes, UTI cannot really be acquired from a public toilet, even for a woman. This is what
Wonderful.
I think.
Yeah. Thank you. So no UTIs coming from public toilets. Have I dropped off? No. Okay. All right. So we have a diagram here for, on the background in case any of our viewers want to follow a little bit, and we'll move to some other areas of interest also. Dr. Tharyani, let me ask you another common problem or that people or patients come with is, the holding or not holding of urine for long. Does that affect your chances of getting a urinary infection or prevention for that matter? Is any one better than the other?
Definitely. Holding excessively long hours, definitely.
Have we lost Dr. Tharyani? Is her connection not great? Or is mine not great? Hello? 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 Hello?
I think there's some connection problem.
There's some connection issue. We'll come back to
Yeah,
Dr.
we
Tharyani.
can hear you, Rashna, but we
We'll-
can't hear Dr. Tharyani.
Okay, we'll come back to Dr. Tharyani and that question in particular. Let me come to, she'll probably log back in.
Sorry.
So
I logged out.
let me, hi, hi, Dr. Karishma, when you're back, hi. So do you want to get back to your answer? Sorry, there was some connection issue. You were saying about not holding urine. Yeah.
Yes,
You
I
were
was
saying?
saying that definitely holding urines for long hours can increase your chances of getting a UTI, and not just holding urines. Holding urine. You just asked Dr. Nidhi if public toilets. So public, like she rightly said, public toilets do not cause UTI, but fear of public toilets, like taking abnormal postures while passing urine, standing and peeing, or hovering over the toilet seat, or bending down to pass urine. All these things can lead to incomplete bladder emptying, which can lead
Okay.
to your to increased chances of catching an infection.
Okay.
So ideally, one should just listen to her body. Like you should not pass urine too frequently. Like I'm very scared of using the public bathroom. So every time I'm stepping out of the house, I'll go and pee. Whenever you have the urge, you should go and pass urine, not excessively and not holding for too long.
Wonderful. So the very simple message is that listen to your body, be natural, and don't either hold back or go again and again, or do very different sorts of postures which may put odd strains on your pelvis. Okay, thank you for that. So since we have such a diverse panel here, right from Delhi NCR to Mumbai to UK, and with Docgeny and with telemedicine reaching worldwide, I would be interested to know, sort of the differences in pattern of infection that we're seeing, or presentations. When do people come to you? Do they come early? Do they come late? In your areas of practice, and I'll address this to all our panelists. And also, sort of their own practices vis-a-vis urine infections. Also, maybe just briefly touching upon simple antibiotics or complicated ones. What do you start with in your areas of work? I can start by saying that when I practice in the US, I'm able to use very simple, first, second line antibiotics, and they work. In Delhi, a lot of resistance, and so one has to be careful depending on how severe the symptoms are, what we are starting with. So I will turn that over to Dr. Chauhan, Dr. Nidhi Sharma Chauhan. How is practice in Mumbai? And when do your patients present to you, and what sort of antibiotics? Tell us a little bit about practice in Mumbai.
Yes. Okay. So I would say that practice varies according to the area and the hospital. When I used to be practicing in a government hospital here, we would see a lot more non-compliance and with the patients. So they would take half the treatment, which would lead to antibiotic resistance, recurrence. But now that I've been in the private for last couple of years, I don't see so much of delay in taking treatment or people taking over-the-counter medications either. So I really haven't seen too much of resistance, only in certain types of women. Like, if they have a prolonged surgery, they've been catheterized for too long and multiple antibiotics have been tried. Yes, there I have seen, but otherwise on routine basis in the OPD, for as such for UTIs, I don't see so much of resistance. And I think people are getting more compliant and they're very well read thanks to all the technology that we have. And like I said, it just varies where we are. And, in Mumbai also. Yeah.
Great. Dr. Garg, your experience?
Ma'am,
and I'll come
As
to
Dr. Nidhi rightly said, the incidence
you,
and
Dr.
the type
Kucheria.
of people suffering from UTI varies depending upon the area that you are practicing. So, I get all kind of patients. I get from like community acquired to hospital acquired to complicated to like many different type of UTIs like kidney abscesses and so on. So, as far as the treatment is concerned, yeah, I use a simple algorithm to like further subdefine the UTI as a complicated UTI or a uncomplicated UTI. Okay, so if I'm encountering mainly uncomplicated UTI, so you discuss about like what antibiotic patterns like I am commonly choosing. I am commonly choosing nitrofurantoin, fluoroquinolones, and fosfomycin for uncomplicated UTI. And if
Uh, doc, doc, yeah, Dr. Gaurav, I'm going to have a scale back a little bit because our audience is layperson. So maybe we
okay,
won't go into the type of group.
okay, so like to make it more precise, more simple, UTIs whenever they are treated, so we have to
But
subdefine
you're
whether it
saying
is a simple UTI.
that basically, yeah, election issue with Dr. Gaurav. Yeah. So you're saying we have to specify if it's a simple one or more than a simple one, right? Okay.
Yes,
Um,
yes. Why
and
it is important? Because the duration of therapy matters. Plus, we need to see we any further testing is required or not. Like, and accordingly, we can guide for prevention also, so that recurrent UTIs they don't happen.
okay, great. Dr. Thari, I'll come to you and then Dr. Kucheria. Geographical differences or differences in presentation that you are seeing and issues with that, people behavior or a virtue of where they live, that playing into the management of UTIs.
So, ma'am, I agree with most of whatever has been said by Dr. Gaurav and Dr. Nidhi, that women who are well read, who are informed about their disease, are usually more compliant, and they get themselves tested, take the entire course of antibiotic, do not stop the course in between once the symptoms settle down, and hence in such women chances of getting reinfections are much less. Vis-a-vis women who self-medicate or who keep repeating their prescriptions, or because of an increase in online consultations, and sometimes because the patient is so much in distress, they just call up their doctor and start an antibiotic without proper culture test, without proper urine testing. All these things, they increase the chances of poor outcomes after treatment. So if a simple protocol or an algorithm is followed in which we get the patient tested, go by her symptoms, then classify her, as Dr. Gaurav rightly said, as complicated or uncomplicated UTI, look for risk factors, and then treat while informing the patient about the importance of compliance and the duration of treatment, usually the outcomes can be managed.
Okay, great. Thank you. So the takeaway from here is that especially if you're getting a UTI again and again, do not self-medicate. Don't take your old prescription and go to the pharmacist. This may be a cause for concern. See your doctor, or at least make sure that, even if it's a online teleconsult, which, for sometimes for people that may be the only access, then a proper protocol is being followed. You're consulting with the right person. Dr. Kucheria, your thoughts on this? And then we do have a question, which I'm just going to put out here. Yeah, go ahead. In fact, I might put this to you.
So,
I'll put it to Dr. Thariani. Yeah. Okay. Yeah.
okay.
Go ahead, Dr.
So
Kucheria.
I think
Yeah.
the slight difference probably in the Western world is that the restriction of antibiotic use is quite prolific. So unlike like in Delhi or India, you can just go and buy antibiotics and start. Here is impossible because it has to be given by a clinician on prescription. So we don't see that much resistance, but saying that resistance is increasing globally from travel, from people getting multi-resistant bacteria in other parts of the world and coming here. So important thing is, yes, treat with the right antibiotic and the right course, as in the duration of course of antibiotic. So there has been some studies about 1 day, 3 day, 5 day, 7 day of antibiotics. 5 and 7 have more or less same efficacy, which is better than 3 and certainly much better than 1 day single dose antibiotics. So we tend to go for 5 days, unless it's a very simple UTI in a young lady, then we sometimes give it a 3-day course as well. More importantly, there's some studies now suggesting, look, the base cause for all these problems is inflammation. And if inflammation is severe, the risk of getting recurrent infections also increases significantly. So there's a very good study which suggests that if you start anti-inflammatories.
Sorry. Dr. Kucheri, I'm going to have you pause here. Maybe you can, maybe for our viewers, can you hear me? You can simplify a little bit. What is inflammation?
So देखिए, अगर infection की symptoms आ रहे हैं, even before you get to see a doctor and get your antibiotics, you have normally things like paracetamol or brufen at home. Start the anti-inflammatories. It'll bring down the inflammation. So severity symptoms that will come down, which will certainly help in reducing the severity of that infection, that particular infection. But more importantly, it cuts down the risk of getting recurrent infections quite significantly. So both are equally important things. So please do make an appointment to see a doctor and get the right antibiotics. But while you're waiting, start the anti-inflammatory as well. And that will certainly be beneficial to you and reduce the risk of recurrent infections. So that's important. And if you're getting infections again and again, like recurrent infections or severe infections, I would advise that the patient to get a urine culture done, because you will not, knowing just by sort of saying, okay, I'm taking this antibiotic doesn't help, because sometimes you can get multi-drug resistant bacteria, which may be resistant to a particular common antibiotic. And even doctors don't know till they see the culture report. So culture report is equally important sometimes, especially if you're getting a severe or a recurrent infection.
I'm muted. Thank you for that. I'd like to stress upon 2 points here with all the important ones that you said. One is about resistance in overseas being much less, reason being that there's strict controls on antibiotics. And so that's one of the key messages that our viewers need to take back, that be very careful when you're prescribed antibiotics. Most of the time you don't need them. So question your doctors if they are giving you antibiotics, why they are. Any other antibiotic can also cause resistance for the urinary infection. We have some background noise. If you could mute yourselves, whoever it is, that'd be great. Thank you. And the other one about, besides the infection, which is what the bugs cause, the bacteria cause, the inflammation, which is just irritation of the tissue, that happens as well.
Is she audible?
And that even before you've had a chance to see the doctor or an ibuprofen, your symptoms, and then of course consult your doctor the next morning. We have a question here, and I will address this to Dr. from a physician or somebody who suffered from this. Hello. Asymptomatic bacteriuria, an indication of starting antibiotics. So to put it very simply, sometimes a patient may not have any symptoms, and their urine report is showing something abnormal, pus cells or bacteria or both. Should your doctor put you antibiotics? Dr. Tharyani, I'm addressing this one to you. And of course, anyone else can raise a hand and join in afterwards. Yeah.
Dr. Ratna, for this question. First of all, asymptomatic bacteriuria does not require treatment in most people. There are only 2 indications where we treat asymptomatic. One is during pregnancy, and other is if a person, or if a woman or a male patient is undergoing a surgery in his or her bladder. These are the only 2 indications where asymptomatic bacteriuria needs to be treated. Otherwise, there is absolutely no indication of treating asymptomatic bacteria, no matter how many pus cells the routine report is showing or what the colony count, the culture is showing.
Hi. Dr. Garg, do you have background noise? If you can just mute when you're not answering, I'm requesting. Sorry.
Yeah,
I know you're in
I
the
will
hospital.
No, actually, I'm in an isolated room. Okay, I'll mute it now.
Okay. Thank you.
But on this asymptomatic bacteria, I want to add something.
Welcome, please.
Ma'am. Actually, first we have to see ki, like whether as we have to make ensure that the urine sample collected is properly collected. Okay, for documenting asymptomatic bacteria. And secondly, we have to see what population it is. Like if we have a special population like a immunocompromised patient or a pregnancy is there or some cancer patient is there. So these special populations who are at risk of developing a severe infection. So in those populations, selected like giving of antibiotics or selective treatment of asymptomatic bacteria can be considered. As a like extension to this, I get a lot of orthopedic patients, like they are bedridden. They are awaiting approval for their surgery, and when they get a urine test done, it is showing like bacterial growth. So I always don't treat them because they are asymptomatic.
Okay, got it. You mentioned a very important topic that's relevant to people watching us: proper collection of urine. What must our women and men viewers keep in mind when they are giving a sample? Dr. Gaurav, I'm asking you this since you mentioned proper urine
Okay,
collection.
so we have to ensure that the urine is collected properly so that the urine reports are optimum. So if we talk about the urine collection in females, females, they have to collect urine in a midstream method because the initial urine that comes is represents the urethral sample and it is mostly contaminated. So we have to ensure a midstream sample. Midstream sample involves cleaning the private part, let the first 10 ml of urine pass out, and the next
Pause.
urine that comes has to be submitted for analysis.
Great. And how do you clean the private part? Is it just water? Is it douching? Is it water and soap?
Only like if it is cleaned properly, water is almost equally effective in cleaning
Great.
the private part. It should
Great.
not be
Wonderful.
visibly contaminated.
Great. So, in short, just wash the private area with water and let the first part, like you open the tap, you let the first part of the water, the urine go away, stick the cup in the middle part, stick it out, and finish passing urine. I think that's as graphic as I can get, but probably gets the point across. If anybody else has any practical tips on this issue, which is so important, and we run into difficulties when we have women on diapers and other sorts of things, catheters. We're not going to go into that right now, but it is a sort of a minority, but that is an issue. Anybody has any pointers on those kinds of population, on elderly who are not able to get up, go to the bathroom? Practical things that you've been using that our viewers find. Not audible?
Your voice keeps cracking in between. Is it my network or
There was a glitch in your network, I think. It was
Okay,
just,
sorry.
yeah,
Sorry.
it's happening again.
yeah.
My network. I also think we have a ring again. Is it Jyotika? Hi. Am I back on?
There is a continuous glitch in your voice.
I need to take
Uh,
don't know what to do. I have
Maybe you could turn off your
okay,
camera
hopefully
for
it
some
stays
time.
stable.
Yeah, if not.
I'll try and do that. Let's see. All right, the
That's
camera is switched off. Yeah, so I guess my question was about, now I've lost my chain of thought. Let's
you
come
were
to,
asking
we
there are
had
some
talked about,
special populations who are on diapers and like who may not be able to get
yeah.
proper midstream
Right.
urination. So what are the
Right.
options to collect urine in those populations?
Yes.
So So my thoughts on this is, ma'am, like in those populations who are catheterized, bedridden, and they are unaware of how to give a midstream. So, like a best way to give sample is use a small feeding tube and take the urine sample. So that will represent the true bladder flora.
Okay, so that the lab technician probably has to do, because most people are not able to do that. But to the extent possible,
Roshna, your audio is
Great.
quite
Yeah.
broken.
We have a UTIs, cranberry juice. All right. What I'm Okay, what I'm going to do is just send the topic across and see if on the message you can see it and answer the question. We have a raised hand. Does the DocGenie team want to have that person ask their question while my connection gets better?
So I can answer the cranberry question if you like.
Yes.
It's quite a topic I discuss in clinics quite a lot with my patients. So with regards to cranberry juice or tablets, cranberry has a special substance called tannins. This is something which then does not get eaten, metabolized by us, but it comes in the urine. And bacteria have more attraction towards tannin than our lining of the bladder. So it'll attach to it and it'll flush out in the urine. That's how it works. The problem is that it has been, in my opinion, overhyped a little bit, because the efficacy of cranberry tannin is around 5%. And I specifically choosing very clear words, like not saying juice, because अगर आप juice का जो ingredients देखेंगे, उसमें amount of cranberry is minuscule if there is any. Most of the juices you get in cranberry, like especially bottled juices of cranberry, they are cranberry flavored sugary drinks, which actually work adversely, because sugar will increase acidity in urine and also increase the risk of infections. So if you want to take cranberry, either take, natural cranberry and juice it yourself, and you might get some relief with it. Or nowadays, even lots of supplements come in tablet form of cranberry, and they also have, but the efficacy or the advantage is only around 5 or 10%, which if you flip it the other way, 90% times it may not benefit you that much. Similarly, there's something called D-mannose. So I know you haven't, the person who asked the question didn't ask, but D-mannose also has a similar way of working. It's a sugar which we don't metabolize, and in the urine it then again comes in, and the bacteria have more attraction or affinity to mannose than to getting stuck to the lining of the bladder. So they do reduce infections, but then you have to take it regularly, 3 times, 2 to 3 times a day. It comes in powder sachet, so but drink with a glass of water. And again, it's well tolerated, but it's another way of managing or preventing infections, but it has no role when you have an acute infection.
Okay, great. Anybody else want to add on to Dr. Nidhi about any foods that you advise, or any other suggestions for prevention of UTI? I think that's a topic that everybody asks. How can I prevent a UTI? Dr. Nidhi, any thoughts that you have?
Yeah, so I think prevention of UTI is basically trying and not doing the things, remembering the factors which are actually causing UTI. That means not holding on for too long, not holding the pee for too long. One must go to the washroom as and when they should, and keeping themselves hydrated. Of course, not taking over the counter medications, and having a UTI diagnosed correctly, and taking the antibiotic only when necessary. And yeah, I think, and of course, for women, a very important thing is wiping from front to back. And yeah, so that's what I can think. And these preventive measures like cranberry, Dr. Kucheria has just clarified a lot on that. So we do have some insight over there as well. Yeah.
Thank you. Thank you. That's excellent. Hygiene, the hydration, not holding back. And as Dr. Kucheria mentioned, cranberry, maybe 5%, if at all. So not relying on that, and the juices having very little. I have
You're not audible.
Then I would request the host question whenever you like. And I, oh, it's Rajesh, sorry. I'm sorry that my law. I am coming on the topic of recurrent UTIs and older women. If I'm at all audible, I'd like to start with doctors that happen again and again, and especially in the and what should we be looking out for? Also, okay, if I can message chat recurrent UTIs, older women.
Dr. Rachna, I think you've asked me to talk about the why do UTIs increase in women, in elderly women.
Older women,
one
yes.
of the most important reason why UTIs increase in elderly women is because of the estrogen deficiency. Now, normally in a woman's vagina, there is a microbiome. That is, we have some friendly bacteria. These friendly bacteria do not allow other offending bacteria like E. coli to climb up from our gut into the vagina and then into the urethra and into the bladder and cause a UTI. Now, these friendly bacteria, they feed on estrogen. Let me put it like this, that they need an acidic pH in the vagina to survive, which is brought about by estrogen, presence of estrogen in the body. So as a woman approaches menopause, that is in the perimenopausal age group, once she is menopause, and then as the years following it, the incidence of UTI keeps on increasing. This is because the vaginal pH and the microbiome changes. That is why elderly women have higher chances of catching a UTI. Also, as our age progresses, comorbidities like diabetes, ability to completely empty the bladder, they all decline or they may decline. Chances of pelvic organ prolapse or the bladder falling out of vagina also increases as a woman ages. All these things increase the chances of urinary tract infection in women as they age or in elderly women.
Great. Dr. Garg, Dr. Rajesh, if you would like to have any opinion on this, and how do you treat it besides the antibiotics? Are you giving estrogen? Are you giving hormones? If you would like to opine, Dr. Garg, I'll let you go first.
Ma'am, I'm in a good proportion of these perimenopausal females. I am using local estrogen, and I'm also checking for urine retention. Like a lot of women in these age groups, they have difficulty in evacuating out the bladder. So, I'm kind of doing a lot of toilet training for these females by telling them to pass urine easily, avoid like overfilling the bladder, like doing time voiding. And in a couple of females, I'm also giving alpha blockers, like medications that decrease the bladder outlet resistance, so that the urine flow is optimal. That also I have seen it decreases the chances of UTI in the long run, like recurrent UTI in the long run. As Dr. Nidhi and Dr. Karishma, they also said that this is not only a problem related to the mucosa. This is symptom syndrome complex that affects the bladder also, that affects the vaginal area also. So all these things collectively need to be taken care of.
Okay, great. Dr. Kuchek, Dr. Rajesh, do you have anything to add on this topic of recurrent UTIs, older women? Yeah.
Yeah, no, thank you. So I think Dr. Garg is very right. I mean, estrogen deficiency is one of the commonest cause for menopausal or postmenopausal recurrent infections. And topical estrogen is used. Slight caution is if patients have issues with any endometrial disorders or history of breast cancer, you have to be a little bit careful and advise them. And you may not be able to prescribe estrogen in those situations. And in elderly population, again, with aging human or any sort of living creature, organs dysfunction increases. So it's important to check bladder emptying, like Dr. Garg said, they might have outflow obstruction, but more importantly, sometimes prolapsing organs, especially cystocele, rectocele, they can also impact your bladder emptying, and that can affect having more infections. So looking into the urological side of infections or causes for infection is also important. So an ultrasound scan, sometimes even a cystoscopy might be necessary. Um, Sometimes they can get inflammation of the lining of the urethra called caruncles. The infection starts from it. So again, a proper examination assessment is a little bit more important or pertinent than in a young female, for example, where you on examination you rarely find any pathology as such. So those are important things. And I tend to use intravesical or treatments inside the bladder because there is very good studies about there's a thin lining inside the bladder made of protein called gag layer or glycoaminoglycans. So for our audience, it's like a sort of a mucus lining inside a bladder, and with infection, inflammation, it becomes depleted. This is not seen on scans, not seen on endoscopy as such, but it is something which has been shown on ultrastructure or microscopic analysis. But then applying or putting in medication to supplement it certainly helps in reducing infections significantly. So that's something going into a bit of a specialist realm, and I'm sure Dr. Karishma, Dr. Kaurav might have some experience with Dr. Chauhan as well. But in sort of when by the time a patient comes to us after being seen by a GP or having multiple treatments with different doctors, so we are kind of that's the end line treatment. That's not something which I would say everybody needs at first line, but that is something which is effective when you don't either patient doesn't want more antibiotics or you've exhausted your antibiotic spectrum and you're still having issues. So there are other options and treatments. They're more pertinent for the postmenopausal women because instrumentation and things are involved, and younger women may not tolerate it that well.
Great, great. So to summarize and put it very simply, and I hope my internet is behaving this time, is that as women get older, the hormone that is good for the area, the private area around the urinary area, vagina area, reduces, which is the estrogen. That helps the good bacteria. So now the bad bacteria can attack and they get more UTIs. And that's one of the reasons. Other parts is as all of us get older, tissues become loose and lax and may start to come out, protrude out, prolapse, or not be so muscular and loosen up, which holds back urine, prevents you from passing urine energetically. All those things also can make you prone to urinary infections again and again. And so your doctor will treat you whether you're going to a GP or a gynecologist. But if this is happening again and again, then your sensible physician will refer you to the specialist so that a good look can be taken with scopes inside and some more specialized testing can be done so that you are not bothered by these again and again, as they can become dangerous, which I will come to in a minute. We have a couple of questions from the audience. One is about panty liners. Dr. Nidhi Sharma Chauhan, any opinion on panty liners with respect to UTIs? That's one question, and I will put the other one to Dr. Tharyani about oral probiotics, if you can think of that one after Dr. Chauhan answers the one on panty liners. So over to you.
Yeah, so with panty liners as such, they don't cause UTI, but they have to be changed at a frequent time. They must be changed like every couple of hours. One cannot, that is what is important for the hygiene. And that can predispose a woman to UTI. It is not using the panty liner which can cause the UTI in the woman. I don't know if that was the question from the audience. Is that answered? I assume that is what they wanted to know, right?
Yeah, I think that makes sense. That basically not keeping the panty liner on for too long. Yeah. And my opinion also would be that a cotton lining which breathes any of the fluid coming out from the area is better versus a panty liner which has synthetic substances and therefore needs to be changed again and again. So I hope that answers your question. Dr. Tharyani, will come to the question on probiotics. Are they helpful at all? Vis-a-vis UTIs, preventing UTIs. Diabetics, elderly women. Yeah, go ahead.
As far as probiotics are concerned, there are some studies which say that if probiotics given in the right dosage and the right bacteria may be able to replenish the changing vaginal microbiome which may happen in the elderly women. but there is a lot of difference in what the studies say and what is available in the market. Usually in the Indian market, the probiotics which are available do not have that kind of bacteria which are required to prevent the UTI, and neither is the dosage or the storage of the probiotic done correctly. Ideally, in most of the studies concerning the probiotics and the use of probiotics to replenish the vaginal microflora, the probiotics are stored at a particular temperature, whereas in India, they are loosely available at most medical stores with no maintenance of cold chain, and the bacterial dosage and the type of bacteria. Lactobacillus dispatis is one which is on which most studies are based. So this is usually not seen in the probiotics which are available in the Indian market. So as far as the Indian scenario is concerned, I usually do not recommend probiotics as a mean of preventing UTI in my elderly women, because as it is on a lot of medications, and there's no point of adding one which does not have evidence behind it.
Anybody have any alternate thoughts to what Dr. Tharyani has just said about probiotics? Yes.
Yeah.
Yes,
So
please
can
go
I
ahead.
just add
Yeah.
my experience? So I agree that oral probiotics don't have a significant impact on recurrent urinary tract infection. Those are different systems, GI system and urinary system. So yes, you can change the flora in your or the bacteria in your gut, which might improve immunity. So secondary benefit is there. Primary benefit is not there. There's been a very good randomized study done many years ago in a Scandinavian country called in a University of Lund in sort of Sweden, where they did a randomized trial and they found that there was no benefit between the control arm, which means they didn't have any probiotics, and the treatment arm, which had probiotics, oral probiotics. There is some evidence of using topical probiotics, but that is difficult. That you're mimicking basically same as estrogen supplementation, where estrogen in vaginal area will increase lactobacillus, so it will help in protecting from opportunist infections. Some studies showing where you can take a tampon, you can soak it in live yogurt and keep it in for an hour every day. But it's a very messy way of doing things. Most patients who tried it 90% give up because it's not something you can do, and then also it creates sometimes an odor from the yogurty sort of things, and you don't know whether it's thrush or whether it's yogurt. So it's not practical. But there is certainly a lot of evidence now coming that the whole root of infections or reduced immunity comes from our gut microbiome, और हमारे जो gut के friendly bacteria की deficiency से you can get a reduced immunity. So improving gut health is becoming a primary sort of priority for a lot of chronic conditions, but also for recurrent infections. And there is increasing evidence. I mean, this is all new. So some people have done good studies already, but more and more studies are being done. So in the next few years, we might be able to move away from antibiotics towards more of controlling bacterial sort of population or bacterial species in our gut and improving our health from that. So that is something which is to look forward to.
Wonderful. I think that is great.
And one other point about linings or panty liners.
Yeah.
The more expensive a liner or softer the liner, the more bleach it has in it. This is something which has been shown, especially in anorectal studies, that people who use very posh toilet paper, I know in India, not many people use toilet paper, in Western country a lot more, but the more expensive the toilet paper, the more chances of getting inflammation around the anus. Similarly, because to soften the paper, you need to add a lot of bleach to it. Same thing happens with liners. So the more expensive or softer the liner, the risk of getting inflammation increases. So you have to be very careful. So if you can use natural or try and avoid them, it's certainly important.
Excellent. Thank you. Those are really good practical tips, and also a segue maybe into another webinar that we will be doing on gut health, obesity, immunity, all of that. Dr. Nidhi, I'm coming to you there's an audience question, and then it relates to, I know one of your area of expertise, fertility. So there's an audience question on pregnancy, and the exact question here is, what can be done when pregnant? So I assume the participant is asking that what can be done about a UTI when pregnant. That's one, and the participant, please detail it if I've not got your question correctly. And the other one is fertility, we also have a younger population, I'm sure, who joined us, who are looking to get pregnant. And as we know, because of the lifestyles, more and more women have delayed pregnancy. And so there is a large population that is coming to us seeking fertility or pregnancy options. Do UTIs have anything to do with fertility or future fertility? So these two questions for you, Dr. Chauhan.
All right. Thank you. Well, the first one, to address the first one, that in pregnancy, the same precautions need to be taken. One needs to be hydrated well. Do not hold the urine for long. Wipe from front to back. Do not medicate on your own. That's even more important during pregnancy. And like we've discussed earlier, that pregnancy is one of the areas where an asymptomatic bacteria needs to be treated. I would not like to go into details of that because that has another, why it needs to be treated is something we can discuss later. But yes, so during pregnancy, of course, your doctor at one of the visits would recommend a urine test, a simple microscopy to look for asymptomatic bacteria. And that needs to be treated in pregnancy. As for what the woman who's expecting can do, the precautions are the same. Really, there is nothing different. Yes, a pregnant woman may be more prone, and what kind of antibiotic can be given to her, that needs to be discussed. So I think the most important thing for any pregnant woman actually to remember is never to self-medicate, because every medicine is not really safe in every part of pregnancy. So that is, I think, for the first one, I think I've answered that. Now for the second one, related to fertility and UTIs. Well, there is no relation between having one or two episodes of UTI and developing some kind of infertility. However, if a woman has recurrent episodes of UTI, she is predisposed to have pelvic inflammatory disease. That's because of the anatomy of a woman. That means the close proximity of the vaginal opening to the urinary opening, the urethra. There is a chance that because of the recurrent UTI or an incompletely treated UTI, there can be a development of a pelvic inflammatory disease. Not a full-blown one, maybe a vaginitis, a cervicitis. That means only the lower part of the the vagina, or maybe the neck of the womb that can get infected. And if not treated, that can travel up to the uterus, can affect the lining of the womb, and maybe even affect, so 1 minute, just to say, I have this little thing here because I'm in my clinic. So this is actually the womb here. And so, if it travels up here, these are the tubes on the side. This is not really a healthy womb. It's a little infected. So the tubes here can get stuck, the tissue can get stuck because if there's infection, and that can disturb the relationship of the uterus to the tubes, to the ovaries. And therefore, the normal process of conception, that can be hampered. And that can lead to subfertility or infertility. Hello?
Yeah, great. We got that.
Am I still there? Okay.
Yeah, you're there. Very, very much.
Yeah,
So, very much
I
so.
just
Great.
blanked out. So
Yeah.
sorry.
No,
Sorry.
not at all.
Yeah.
No, you're very much there. Great.
Yeah.
So excellent. Thank you for addressing both those points. We have some really interesting questions, and I'm going to go a little rapidly now because I'm hoping to close by 6 p.m. With respect to all of your clinics and times and other things that you may have to do. Some really interesting questions, and let's go quickly on these. And anybody can take them sort of a rapid fire. So, any recommendations on sexual activity, Dr. Tharyani, in women who are prone to frequent UTI? Dr. Tharyani, about this one. And maybe you can also address postcoital UTI. So, issues around coital.
So sexual activity does increase the risk of
sex.
Oh, yeah. Am I audible? Sexual activity does increase the risk of UTI, and there is a subset of women who end up developing UTI after sexual intercourse quite frequently. These episodes are called postcoital UTIs. Now, one of the first thing to understand here for both the patient and the partner is that the infective bacteria is usually not coming from the partner. It is coming from the patient's own body. So oftentimes I get queries like, should I get my partner tested, or should my partner also take an antibiotic if I am developing a UTI? So the answer is no, because the bacteria, like everybody has talked about, Dr. Rajesh has talked about, is coming from our own gut. It's just the process of intercourse where so much touching around and is being done. The bacterial transfer becomes easier. So one of the ways of preventing it is, like we've discussed, keep yourself well hydrated. And after intercourse, one may not wash themselves or clean themselves with soap and water. It's not a dirty act as such. So it's just a good idea to pass urine after intercourse. This is one of the ways of preventing it. If still you are predisposed to it and you're getting UTIs repeatedly after intercourse, I think you should go and consult your doctor, who can then put you on other preventive measures. So that's about it.
Great. And so one of the questions from participants is, what does repeated urge of passing urine indicate? So I'll just take this myself, that repeated urge of passing urine, if I can be heard, could be a urinary infection, but it could be other problems as well, like a stone. So it's best to consult your physician, and they can get a little bit deeper into your history, get a urine sample, and figure out where this is coming from. But probably one of the repeated urge of passing urine could be this. Other causes are also there, like diabetes that's not been diagnosed. Those are also there. Some other person has asked about, and I'll ask Dr. Chauhan to take this one. A brief answer, please, on what causes fungal or yeast infection. I assume they're talking about vaginal fungal or yeast infection. Dr. Nidhi Sharma Chauhan, you want to briefly take that one, because we're coming to the end.
Is the question related to UTI and fungal infection, or what
No,
general causes?
No, I think it's just general, because we did mention that we would take issues around that area.
Yes.
Yeah.
So, well, again, a fungal infection is pretty common. Sometimes the cause is not really known. More common in women who are diabetic, okay, and also in women who are perimenopausal or approaching menopause because of the change in the pH. Also, there is also an association of fungal infection with the incorrect use of tampons and incorrect use of vaginal menstrual cups nowadays. So all these also predispose. And is that the only thing?
Yeah, that was the only thing.
All right.
Thank you.
All right. So
Thank
that's
you.
brief.
Great. No,
point,
that's wonderful.
Dr.
Yes. Go ahead.
Even overuse of broad spectrum antibiotics can increase the chances of getting vaginal fungal infection. So that is another thing that all the listeners should keep in mind, that overuse of antibiotics can also increase the chances of vaginal infections.
Yes, that's true. Yes, thank you.
Wonderful.
Thank you for adding
I think that message is going across again and again, and we have, yes, Dr. Kucheria, you, Dr. Rajesh, we have you raising your hand as well. Yes.
Sorry, just one more point about post-coital UTIs or sort of around sexual. So yes, I mean, like Dr.
After
Thirani
sex,
said,
just for simplification, sorry, after sex
yeah,
UTI,
after
right?
sex.
Yeah.
So passing urine is extremely important because it does change the environment in the bladder. So your risk of infection will come down. But also, if you're still having infections quite a lot, speak to your doctor. They can prescribe you an antibiotic tablet to take after sex, or what we call post-coital prophylaxis, which also might reduce the risk of infections. And the longer you don't have an infection, the better chance that you won't get infections again. So you're basically prolonging your duration between infections, allowing your bladder to, again, heal up its defenses, and hopefully the infections won't come again. So it's important.
Great. Dr. Garg, again, questions from the audience. Is a morning sample necessary for urine, or can it be at any time if you're sending off a urine sample? That's one of the questions.
It is not necessary. By convention, it is like followed in most of the labs that they should give the morning sample. But what I am seeing these days is like the sample collection and the like transportation is not done properly. So that leads to a lot of errors in the report. So now I am advising my patients to give it to at any time. It should be a midstream collection, and they can do it. It won't make any major difference in the report.
Awesome, great. There was another question on, I think these are some of our doctor colleagues, but sometimes, patients are also looking at their lab reports. If someone's leukocyte esterase and nitrites, or one of them is positive, and otherwise no bacteria on the urine sample, what do you do with that?
Ma'am, I think the question is that if the patient has no symptoms and the urine routine report is showing leukocyte esterase and nitrites, then will the management change? Hello?
Yeah, exactly.
The
Right.
answer is that leukocyte esterase is nothing but an enzyme which is produced by WBCs, and nitrites is the conversion of nitrates to nitrites is done by E. coli, which is a bacteria. So if a patient has asymptomatic bacteriuria, that means she has bacteria in the urine. And that is why these things are present in the urine routine report. So the treatment of ASB does not change by simply because of the presence of nitrites and leukocyte esterase. It is because the bacteria is there that these things are there in the urine test.
So you would treat that person then?
No,
Or you
so
would not?
whatever we have discussed for asymptomatic bacteriuria, that I usually do not treat it in women who are non-pregnant, who are not undergoing any surgery. I usually get it tested, I wait for signs and symptoms, then only I treat asymptomatic bacteria. And most guidelines also support no treatment approach to bacteria.
Okay. And should you be rechecking these patients? Yes, Dr. Garg,
Only if
go ahead.
symptom, otherwise no.
Ma'am, I perfectly agree with Dr. Karishma, okay, because the asymptomatic bacteria, as we have discussed, is to be treated in only special populations. And you have to understand there are a lot of fallacies of urine routine examination. Like there can be lots of false positives and false negatives depending upon like other medications, vitamin C, phosphaturia, like many different conditions are there that can give false reports. Like so, like bottom line is the report should be clinically correlative, and if clinically a physician suspects that there is a risk of a dangerous infection, then some treatment may be given. Or if there is like patient is quite suspicious, then we can do a repeat testing, maybe from another time. Like many patients, they are quite suspicious that this bacteria is coming. I'm having an infection, doctor. There will be some risk. So I personally like do a repeat testing after 48 hours, 7 days.
Okay, great. Well, I think we are at the end of our webinar today. Thank you so much to all our panelists for your very valuable time on a Saturday evening. We really do appreciate it. And I know that this has been useful to people who've been attending, but also the recording will be available on various platforms. So thank you once again to our panelists and to the participants who gave us time this evening and let us explore this very important issue. Good evening.
Thank you. Thank you very much.
Bye.
Everyone. Okay. Bye. 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 Bye.